Off the presses is this new research article about the ERA test. This is definitely a little bit more sciencey than I typically talk about, but I think it's important to understand research and how we get data to help influence patient care. Let's back up for a second and talk about what is the ERA. So the uterus is only sticky and allows an embryo to implant for a very short window every cycle. We call this the receptivity window. For the average patient, it takes about 120 hours of progesterone exposure for the uterus to be sticky for an embryo. However, some patients need more or less progesterone for the uterus to be sticky. The ERA, or endometrial receptivity assay, looks to see how many hours of progesterone your body needs to be receptive to an embryo. We do a practice cycle, take a small biopsy. That tissue is then sent for genetic analysis, and it looks for proteins being expressed in the lining of the uterus that would allow the uterus to be sticky. And a calculation is done to see whether you are on the correct amount of progesterone. While this is really powerful data and a powerful tool, it's important to remember there's some downsides. It does require endometrial biopsy, and it takes about 6 to 8 weeks to do the test, plus another 2 to 3 weeks to get results, and it is about between $800 and $1,000 out of pocket. The question really is, in normal patients who don't have any issues, is it important to do this test before transfer? Does it increase the chances of a live birth? Because that's really what we care about. In the study, they took 767 females planning on doing a frozen embryo transfer of a genetically tested embryo, and divided the patients into 2 groups, a normal frozen transfer and an ERA timed transfer. And what they found is that people who used the ERA test and the people who had a standard transfer had about the same pregnancy rates. Now notice it says the difference was not significant. What is the conclusion from this study? The conclusion is that we should not be doing ERA testing on every single patient. It does not say this test doesn't work in specific groups of patients. There are some groups of patients who it may be beneficial for. I like to use the ERA test in patients with recurrent implantation failure, which means that the embryo has been transferred more than once and they haven't been successful, and really trying to dive deeper to figure out what's going on with the fact they're not getting pregnant, what's going on with their uterus to make it not successful. I use this as one of the many tools to figure out the uterus